For everyone on the line, I'd like to welcome you and say thank you for joining us today. I am Trish Hutcherson, Orion Health Corp's Marketing Director, and I will be with you today throughout the session as your moderator. And on behalf of everyone at Orion, we hope you enjoy today's presentation. And before we get started, I'd like to run through a few housekeeping items with you. Today's phone lines will be muted for the duration of the session. However, if you do have questions, please enter them into the GoToMeeting dashboard provided on your screen. Any technical or logistical questions will be answered in real time. However, questions related to the content of the presentation will be answered at the conclusion of the session. After today's presentation, you will be receiving a short survey, and we'd ask that you complete it to let us know how we did and provide us any additional comments and feedback. And with that, I'd like to introduce today's speaker, John McCullum. John is the Director of Corporate Compliance for Orion Health Corp. In this role, John acts as the company's privacy officer and is responsible for administering our system-wide compliance program. John maintains awareness of federal and state laws and regulations to ensure that Orion meets or exceeds compliance, ethics, and integrity standards with respect to applicable requirements. He is the developer of a proprietary analytical tool utilizing Osmium, which is Orion's proprietary business intelligence tool that compares internal data against industry benchmarks to measure performance and provides regular feedback to senior executives, operational leaders, and compliance committee members. His expertise includes business operations, training and analysis, practice management, system administration, client relations, SQL scripting and reporting, and database administration. John is a Microsoft certified professional, a Six Sigma Green Belt, and a certified compliance professional. He's a member of the Healthcare Compliance Association and the Health Ethics Trust. And so, John, with that, whenever you're ready, please feel free to go ahead and get started.
Thank you very much, Trish, and thanks to everyone who is attending today. I hope you'll find the presentation useful and perhaps even a little insightful. We have a lot to cover in an hour's time, so let's just jump right in. We're going to start with fundamentals and finish with the future of compliance, at least as I foresee it. We'll begin with the history and discuss several laws and regulations, the teeth that have helped drive compliance over the years. And we'll talk about what they are and how they are changing. We're going to talk about building an effective compliance program. This is going to be the meat and potatoes of this presentation, guys. It's going to discuss how you can structure your compliance program. Then we're going to end with the future of compliance. We're going to talk about some trends and innovations, and we're going to talk about some strategies that help encourage compliance effectiveness. So to begin, let's talk about what is compliance. Compliance prevents and detects unlawful conduct, and it promotes ethical business practices. It's important to know this because all of our compliance policies and procedures need to reflect these elements. Allow these two elements to be your litmus test, if you will, when creating your compliance policies. This is a short list of the compliance enforcement vehicles. We've limited the scope of this presentation to just a few laws that are commonly referenced or enforced. I've categorized them by type of law, which is fraud enforcement and privacy regulations, to try and help keep things organized. Now, beyond that little short list, there's don't forget that there are many other regulations out there that you should consider including. Once your compliance framework is built, it's relatively easy to add additional policies. You'll want to tailor your compliance program to the scope of your business. So if you're like a patient statement vendor, there's really no need to have a policy on the Stark Law. So let's start by talking about fraud and some of the laws used to prosecute it. The False Claims Act was enacted by President Lincoln on March 2nd, 1863. So the False Claims Act just turned 150 years old. It's known as Lincoln's Law or the Lincoln Law, and it was enacted during the Civil War to criminalize the acts of unscrupulous contractors. Think faulty ammunition, decrepit horses, that kind of thing. In 2012, the False Claims Act was responsible for $4.9 billion in recoveries. The previous annual record was $1.7 billion. Of the $4.9 billion, healthcare made up $3 billion of those recoveries. So the majority of the recoveries were healthcare. The other stuff was mortgage fraud, defense contractors, things like that. The False Claims Act applies to federally funded programs. Now, that being said, there are laws that apply to all healthcare benefit programs, such as the criminal healthcare fraud statute. So the False Claims Act is the big one, but just know that there are healthcare fraud statutes that apply to all healthcare programs. So back to the False Claims Act. It introduced a provision, it was a key TAM provision, also known as a whistleblower provision, which rewards reporters between 15 and 30% of the monies recovered. In 2012, 67% of the recoveries under the False Claims Act, or $3.3 billion, were the result of whistleblower lawsuits. So the majority of the monies being recovered under the False Claims Act are the result of whistleblower actions. The False Claims Act has been amended several times over the years, most recently by the Patient Protection and Affordable Care Act, known as PPACA or Obamacare. So this is kind of where the Lincoln Law meets Obamacare. The PPACA amendment set thresholds for the timeliness of processing overpayments, thereby adding strength to what are known as reverse false claims. Okay, so why is this history important? Why is knowing this important? Well, knowing and understanding the history helps us predict the future and see into it, okay? Before entering politics, Obama was a civil liberties litigator, so he was a false claims attorney. Exposure to the False Claims Act has increased in recent years, and it's going to continue to increase for at least the next 4 years. The False Claims Act is what he knows, right? And we should expect that that enforcement will be on the rise during his second term in office. Okay, now let's change gears and discuss privacy regulations. There are 3 big players when discussing patient privacy on a federal level. There's the Health Insurance Portability Act, Health Insurance Portability and Accountability Act of 1996, known as HIPAA. There's the Health Information Technology for Economic and Clinical Health Act, that's the HITECH Act, and there's a brand new omnibus rule. When we talk about the HIPAA privacy rule, it provides a distinction between covered entities and business associates. So a covered entity would be a provider, a health plan, a clearinghouse, those big organizations that house the original source of protected health information. A business associate would be a downstream provider of those covered entities. So it would be a billing service, a third-party collection agency, a statement vendor. The enforcement of privacy rules is currently limited to covered entities. So the covered entity is fully responsible for its business associates' handling of the PHI. This is why the covered entities need to have business associate agreements in place with their business associates. Okay? Business associate agreements are also required under HIPAA. All right. So moving on to enforcement. Are the privacy laws being enforced? Well, the first civil money penalty was awarded, and I use the term awarded loosely here, to Signet Health on February 22nd, 2011. This cost them $4.3 million. So I guess it really wasn't an award at all. And small providers are not excluded, guys. There was a 5-physician group that had a $100,000 settlement just last year. So the HITECH Act, this implemented a big thing called the breach notification rule. So when PHI is compromised, you have to notify patients, the Department of Health and Human Services, of that breach. The winner of the first enforcement action of the breach notification rule, Tennessee Blue Cross Blue Shield, on March 12th of 2012, so just last year. This cost them $1.5 million. So, all joking aside, guys, we need to pay close attention to the dates here. Okay, HIPAA's born-on date was 1996, but the teeth didn't come out until 2011. High-tech was from 2009, but enforced in 2012. Let's look at the False Claims Act recoveries, guys. 2012 is almost a threefold increase over the previous annual record, okay? And remember, most of that amount, that $4.9 billion, most of that was in the healthcare sector. So we are seeing increased enforcement, and it's no longer a distant threat. Okay, so what's next here? The Omnibus Final Rule, HIPAA High-Tech GINA. GINA is the Genetic Information Non-Discrimination Act. It's just another privacy law. And this Omnibus Rule pulls those three laws together. It was published in January, so just a few months ago. And it was a result of an executive order signed by President Obama. It is a continuation of the ramp-up on civil liberties enforcement and becomes effective March 26th of 2013. That's next Tuesday. It has a compliance date of September 23rd, 2013. So if you're setting goals and milestones for program readiness, especially if you're a business associate, this might be a good target. One of the most sweeping changes in this rule is a narrowing of the distinction between a business associate and a covered entity. Okay, business associates become directly liable for privacy violations. Let me repeat that, guys. Business associates become directly liable for privacy violations. This is big. It means that business associates must develop compliance programs just like covered entities. Okay. So that distinction that HIPAA made between a business associate and a covered entity is going away. All right. We'll talk about some compliance risks here. So where will the bullets come from, essentially? Enforcement on the fraud side will likely result from a whistleblower, not directly from the government. When you think of whistleblower, you usually think of internal threats like an employee or a physician, but it could also be external. It could be a vendor or a client. I recently even heard mention of professional whistleblowers. These are people entering your organization with the intent of finding a problem, filing an action, and collecting 15 to 30% of the recoveries. So. Enforcement in the privacy sector. This has evolved a great deal. It was completely complaint driven, so it was driven by patients filing complaints with the Department of Health and Human Services. Last year, the government began random audits of a sample of covered entities, and these random audits happen to be a provision of the High-Tech Act. Now we're seeing enforcement on self-reported breach notifications. Okay, breach notification is also a provision under the High-Tech Act. So it seems like this would discourage self-reporting, but that's really what's happening here. If you end up in the situation, self-reporting should limit damages, and it is the law to comply. So failing to report breaches will definitely increase your liability. All right. So that's the quick and dirty doom and gloom, guys. But we need to understand why we're here, right? We must understand the threats in order to adequately address them. All right. So how to begin your effective compliance program? You don't have to start from scratch, guys. The compliance program framework already exists, so don't rebuild the wheel. You'll want to start by using the OIG's compliance model guidance. Here's the link to it. It's also at the end of this presentation. Why should you use this model guidance? Because it's proven, maybe. That's debatable. The reason that you want to use it is because it's the benchmark that investigators use if they were to evaluate your compliance program. Okay. So when you get into trouble, if you get into trouble, these are the things that they look for. This model guidance is derived from the federal sentencing guidelines, and the OIG has customized it for lots of different types of entities. You'll want to read the model guidance that is most applicable to your business, and you want to read it in full. By reading it in full, you're going to gain a better perspective on the goals that the OIG wants you to meet. Within the guidance, you'll find elements of an effective compliance program. These elements are going to be the pillars of your compliance program, and then you'll just have to fill in the gaps. All right, so I chose to use, for this presentation, the essential elements for a third-party billing company. Just like Obama and the False Claims Act, I'm sticking with what I know, and that's third-party billing. Your elements could differ some, but they're actually all very similar. So most of these things should still apply to you. We're going to discuss each and every one of these in the presentation today. So I encourage you to take notes, especially to some of the best practices. All right, the first element, implementing written standards of conduct and policies and procedures. So your standards of conduct, these can either be included in your employee manual or your compliance manual, or both. They should state that the employees are responsible to report compliance concerns. Your employees need to acknowledge your standards of conduct by either signature or some other means. And to emphasize your commitment to compliance, I would highly recommend that you include program adherence in your employees' performance and annual reviews. Okay, policies. Policies are going to be brief and easy to understand. Okay, you don't want a 10-page policy that's straight out of a law review, guys. Employees need to be able to understand the policies, so keep it simple. And also, the policies need to be available to all of your employees. Okay? Procedures. Procedures are going to contain much more detail than your policies. They should be written from a functional perspective by your department heads. Okay? The procedures must conform to your compliance policies. Okay? So policies set the standards, and your procedures are going to support those standards. It's compliance's role to ensure that the procedures conform to your policies. Okay? A couple of best practices here. Consider using a policy approval process. Include management. This can help encourage their buy-in. Keep the policies in a manual that is easy to update. Well, remember, guys, this is going to be a living document, and it's going to require updating as your program and the laws evolve. Okay? Keep your policies in an online repository if you can. The goal for this is accessibility. All of your employees need to have access to this. We use SharePoint for this, but if you're a smaller provider, consider the use of other free cloud-based programs like Dropbox or SkyDrive. All right, the second element is to designate a chief compliance officer and a compliance committee. The compliance officer needs to be a trustworthy and highly ethical individual. And depending on the size of your organization, this could be a sole responsibility. Ensure the designee has adequate training and experience, and don't forget to document this designation in your compliance manual. Okay? This position is going to serve as the focal point for all of your compliance activities. So the chief compliance officer needs to be a high-level official with direct access to the governing body, CEO, senior management, and legal counsel. If you grant the responsibility without the authority, you're wasting your time here, guys. It's not effective. The compliance officer needs to be able to perform investigations autonomously, and that requires appropriate authority. Finding the right person for this position probably won't be hard, but performing your responsibility as the executive and ensuring the compliance officer's role is effective might be a little more challenging. Okay? If you are the compliance officer, go to seminars, join professional organizations, sign up for newsletters, stay current. Things are constantly changing. Find good resources. Orion has a fantastic market alert, by the way, and I think Trish is going to provide this information after the presentation. Okay, so compliance committees. Compliance committee might not be applicable if you're a small organization, so be reasonable here, guys. If you are large enough to have a compliance committee, the committee is going to be chaired by the Chief Compliance Officer. The committee should meet regularly, and should convey a consistent message to all employees. The committee will be the eyes and ears on the ground and should be comfortable with reporting any compliance concerns to the Chief Compliance Officer. So best practices here. I would recommend having a committee member at each physical location if you have multiple locations. Having on-site representation will enable more effective communication. Try to have diversity, represent all functional areas within your organization, from coding to admitting to clinical, cover the whole gamut if you can. Here at Orion, our committee members range from AR management to quality assurance. We even have an MD serving as an advisor on our coding issues. If you're the compliance officer, be accessible and approachable, okay? Get your nose out of the Federal Register, eat in the lunchroom, and talk to people, okay? All right, the third element, developing effective compliance training programs. So pick your method, guys. You can do face-to-face training. You can do e-learning over the web, teleconference, whatever you want. This training has evolved over time from a one-size-fits-all to role-based training. It used to be acceptable to use one-size-fits-all training programs, but it's migrating away from that. And you should consider specialized training for your IT staff, where the focus is going to be on securing electronic protected health information. Your policies should have thresholds that state how soon employees are trained and how often retraining should occur. Be aware also of your state privacy policies. Like, for example, Texas requires that new employees are trained within 60 days of hire. Okay? You'll want to document the training. Okay? It's just like the coding mantra, guys. If it's not documented, it hasn't been done. Investigators will ask to see your logs on this should you have a problem. Okay? If possible, test your trainees to ensure that they understand the material. And finally, you want to monitor your training program. Retraining is where many organizations fail, so you need to have effective controls to ensure that your retraining is happening. All right, the fourth element, developing anonymous reporting methods. This is an easy one, guys. Just Google anonymous compliance reporting service, and you'll get a ton of vendors, okay? The most common is a hotline. It's actually mentioned directly in the model at the model guidance. You can use a website where people can go online into it. If you're a very small provider, I mean, consider using a small lockbox in a common but semi-private area, like a break room. Since they're empty most afternoons. Don't hesitate to use multiple methods here either. Okay, regardless of the method used, it must be anonymous and it must be available to all employees. Okay, so publicize it. Put it up on posters. Include the info in your newsletters. Whatever. The anonymous reports must be directed to the Chief Compliance Officer. This ensures an independent and properly escalated review of the report. It also prevents retaliation. The fifth element, guys, is developing a system to respond to allegations of improper activities. This is one that I struggled with quite a bit initially. But the result, as it turned out, was surprisingly simple. There were two primary needs that I found, and those were that the responses had to be timely, and that the system must facilitate the reporting of misconduct to the authorities in less than 60 days when credible evidence exists. So both these are kind of timing issues. All right? Those two items can be cumbersome when you're managing a compliance program that spans the country. It's going to require excellent communication and follow-through. So what we decided to use was a ticketing system, just like an IT help desk. You know, ticketing systems automatically track your progress and notes. Remember, if it's not documented, it wasn't done. They enable transparency between the chief compliance officer and the committee members. How does it do that? With ticketing systems, you can set up automated email updates to the chief compliance officer as tickets are updated. You can set up automated emails that alert committee members when tickets that they own get updated by somebody else. Okay? Ticketing systems enable you the ability to measure timely responses by using timestamps. They also reduce errors, so you don't forget to report something that needs to be reported. Think breach notification under the High-Tech Act. These notifications could occur well over a year after the event occurred, so you're going to have to be really organized. Now, ticketing systems, there are open source, web-based ticketing systems available. Google it. Open source means free. All you have to have is the technical know-how to set things up. Okay? Because this ticketing system will likely contain PHI, you're going to need to ensure that it's secure. All right, the sixth element is conducting internal monitoring and auditing. Now, guys, this is where the rubber meets the road. The old way of doing this was very labor-intensive, okay? Data sampling and analysis, you have to start there. It's very manual. You create the reports, you distribute the reports. Again, that's manual. Corrective action plans, manual. This process is then multiplied by every item that you are monitoring or auditing, okay? And now we've entered the black hole of time consumption. And it's going to take everything that you have to offer. Because this is an incredibly labor-intensive process to maintain, it often gets overlooked, or the scope of the audits becomes insufficient over time. Okay? That's the old way. Is there a better way? And yes, this is the new way. Okay, so those of you that are actually paying attention are saying, hang on, John. Yes, you're correct. These are the same bullets as the previous slide. Look, internal monitoring hasn't changed, guys, but the execution for larger organizations has. Let me explain. The new way uses measures and visual analytics. So hang on tight, guys. We're about to take a deep dive into reporting. I promise not to let you drown. Well-defined measures are going to allow you to monitor by exception as opposed to using random sampling. Okay, so to build a compliance measure, we need to begin by asking ourselves the following questions. What is the compliance policy? Can the policy be measured? If so, how is it measured? Okay? Not all policies can be measured, but many of them can. The point is, if you can define the rules or the logic of the measure, then you can programmatically monitor the entire data set and then filter out the noise and focus on the problem areas. This way, your time and effort is fully dedicated towards solving problems. All right, let's use an example, a topic that's been receiving a lot of attention lately, credit balances, okay? Let's start with your credit balance policy. What is it? To have the credit balances resolved within 60 days, that's what the PACA requires, so we'll use that. Can the age of the credits be measured? If so, how? You can use the last transaction date on the patient account, you know? You can use the last note date, you know. Yes, you can measure it. So now that we understand the logic, let's start defining the measure, okay? what would be excellent? Let's say less than 30 days old. Credit balances less than 30 days old are excellent. Let's say that credit balances 30 to 45 days old are good. Say credits 45 to 60 meet our minimum threshold. And now remember, at 60 we're going outside of our policy. So anything greater than 60 needs improvement. Okay. Next, we're going to want to assign a color to each of these scores. The colors are important because they transform our measures from data to visual comprehension. This is going to make more sense in just a few minutes, guys. Orion uses the following color scheme here for all of our compliance measures. It's essentially a play off the stoplight plus blue to show excellence. So data transformation. If you're in a small office, this might be how your credit balance measure would look. This client, or maybe practice or facility, in your case, is named MD. MD has a score of good. The score is derived from the point at which the stacked bar chart crosses the 80% threshold. Okay, so you can see 74%, or in the blue, 74% of MD's credit balances are less than 30 days old. 22%, roughly, I'm guessing, of MD's credit balances are 30 to 45 days old. So the point at which this stacked bar crosses that 80% threshold is green, or good. So that's what scores to measure. When building the visual display, a few suggestions. Okay? Always clearly indicate what the colors in the legend mean. Make them make sense. Okay? The color scheme should stay consistent throughout all of your measures. Consistency is going to be critical. And most importantly, remember your audience. In compliance, you're targeting managers to C-level executives and governing boards. Okay? So beware of too much detail. So we chose to use stacked bar charts, but just know that other methods exist. Think of consumer reports scoring circles, where they've got the total black circle, the semicircle, half black, half red, white circles. You know, take a method and use it. Be consistent. All right, data transformation with larger data sets. If you're in a larger organization with several regions or more offices, your credit balance measure might look more like this. Okay. When building a visual display for many offices, remember to keep the design scalable and consistent. So let's say that you're a regional director with this list of offices that you're responsible for. Heck, let's imagine this list is 200 offices long. If you're trying to improve your compliance levels, you don't want to look at every office. There's an easier solution, guys. You want to include filters, okay? Including filters allows you to manage by exception. Because we've defined our compliance scores, we now have the ability to filter or essentially drill down into only the offices that need our attention, okay? Now, this particular example isn't that useful because we only went from about 30 offices to 1, or 30 different measures to 1. Big deal, right? Evaluating 30 is actually a manageable size. But when you consider that each office may have 5, 10, or even 50 different measures, suddenly that list of 30 items becomes 1,500, and this managed by exception concept becomes extremely useful. Excuse me. All right, so enterprise-level compliance program management. All right, folks, we're starting to pull out of our deep dive. Hope you're all still with me. One of the goals of the compliance program is to keep all levels of management, all the way to the governing board, aware of how the company is performing. With defined compliance measures, it becomes relatively simple to roll up the data and display the information in the form of dashboards at the office or practice level, or at the region level, or at the corporate level, okay? Your C-level suite executives, your C-suite executives are going to love this transparency. All right, so this is what a regional compliance dashboard might look like. At this point, we've moved beyond just credit balances and we've included several other measures, compliance measures, for each region. This is a little bit difficult to see probably because it's a lot of information crammed in here. But let's look at Hawaii. The 5 measures at the bottom are all very different, but because they all use the same consistent scoring methodology, they're easy to roll up into a regional pie chart and score at the top. Okay? By using consistent scoring methods, you're able to view huge amounts of disparate data in one logical and meaningful format. Okay, and finally, this level of graphic would be aimed at the highest level, like a board of directors. Okay, this represents all measures for all offices for all regions, rolled up into an enterprise level compliance score. Again, note the consistency. It enables fast uptake. Okay. So what else can be measured, guys? Think coding, all right? CMS gives us rules that they measure. They've got the CCI edits, the National Correct Coding Initiative. They've got their MUEs, medically unlikely edits. All those things are measurable against your receivables, okay? Think about RAC auditors. All these guys are doing is data mining CMS data. Measure what they're looking for, you know, identify the things that they are looking for before they identify them for you. Okay. Look at the OIG work plans. If you want to look out into next year, you know, look at what they're looking at. See if it's measurable. Create the measures. You can look at physician utilization. You know, there are only 24 hours in a day. Use RVUs to measure that. Look at employee training. Compare your training modules against your active employee list. Measure your employee logins. Create a measure that flags termed employees with active logins. Look at your denials, guys. Denials are a big hit in the reimbursement side, but they should be big in our compliance side too. We can identify coding errors by looking at the denials. You know, use those adjustment reason codes within your electronic remittance files. So I could go on here, but be creative. Look at your policies. I think you'll find that many of the policies that you have can be measured. You just need to define how. Okay, so let's discuss effectiveness, program effectiveness. Data-driven decision-making, guys. Numbers drive decisions. If you can convey the compliance threats with measures, you will gain understanding and buy-in from your leaders. Okay? Relativity between regions or offices. Okay? Look at it from the perspective of an office manager. They're now being viewed objectively alongside their peers. It's a motivator. There's total transparency to all management within the organization. Again, it motivates. Transparency. Now that you have the data, automate notifications. Automate the work, guys. Schedule reports to your C-level execs, monthly, quarterly, whatever they want to see. Push active logins for termed users that need immediate attention to your IT group. You know, automate some of these tasks. All right, I think we beat this horse to death, but I think you probably get the idea. Finally, the 7th element is developing policies to address the non-employment of sanctioned individuals. Now, it seems that this should really be part of your policies and procedures, which is the first element. Why did the OIG split this one out? I really don't know. I guess they think it's just really important and that it deserves its own element. Federally, we are required to conduct annual screenings. Okay. However, you need to be aware that several state Medicaid programs are requiring providers to conduct this screening monthly. So I do anticipate that monthly will become the standard within the next few years. So if you're setting it up, just do it monthly. this exclusion screening used to consist of 3 lists until recently, but the GSA consolidated their 2 lists. So now we just have 2 lists to look at, one for the GSA and one for the OIG. And the links to each of those lists are available at the end of this presentation. Okay, compliance trends. We're seeing a migration from compliance to integrity. It's becoming less about what the law says and finding loopholes and more about doing what's right, okay? So the games are going away. We're seeing retaliation-based lawsuits. Retaliation is a provision under the False Claims Act, guys. So even when companies are being dismissed of a false claims violation, they are losing the subsequent retaliation lawsuits, okay? So have a well-publicized anti-retaliation policy in place. And like we beat to death, quality measures, guys, compliance quality measures. We beat this to death, but here's why. Quality measures are at the heart of PACA, the Patient Protection and Affordable Care Act, and we must evolve with the regulations. Okay, think about Medicare's pay-for-performance initiatives and the physician quality reporting system, okay? This quality measurement concept goes far beyond a trend in compliance. It's an industry trend. Okay, as promised, here are the links. So you guys are now experts on the model guidance. Here's the link to it. Read it in full, okay? After you've read the model guidance, consider reading a few corporate integrity agreements, okay? CIAs are a step-by-step corrective action plan written by the OIG for companies that get in trouble, okay? They can be very helpful to better understand what exactly should be done to meet the OIG's compliance program requirements, all right? And finally, you've got your federal exclusion list. This is the 7th element. All right, so to conclude, compliance programs not only prevent problems, guys, they mitigate fines if an enforcement action were to occur, okay? The government has great liberty in deciding how fines are levied, and they examine your compliance program to determine your level of diligence when doing so, all right? I can't possibly tell you everything you need to know in 1 hour or 45 minutes or whatever it's been. However, I've attempted to provide a foundation to help you build your own compliance program. We want for you to succeed. So feel free to let me know if you have any questions or need guidance. My email address is listed here. Guys, that's all I've got. Thank you for your attendance today. And with that, I'll turn it back over to Trish.
Thanks, John. That was a great presentation, and we did have one question pop in, but before I read that to you, I'd like to just let everybody on the line know that a copy of the slide deck, as well as a compliance checklist, will be forwarded out to you this afternoon, and we're also going to provide an audio playback so that you can listen to that at your convenience. The question that came in is, in what areas do you actually see your clients being hit with compliance issues?
That's a really good question. And, you know, in this presentation, we actually talked about credit balances. And what we're seeing is states coming in with the unclaimed property reporting and doing random audits on practices. So you need to be sure that your credit balances are being worked timely, because if they are not, you're opening yourself up to the state unclaimed property reporting problem.
Thanks. There's a theory that says not having a policy is better than having one. Could you comment on that?
Well, you know, if you have a policy, you need to be following it, and I think that's probably where that question stems from. You don't want to have a policy that you can't follow. So.
Great. Thanks, John. And again, to everybody on the line, we do appreciate your time and attendance with us today. And we will be having another webinar next month on April 23rd. So if you'd like to mark your calendar for that, you'll be seeing announcements come out about that in the next few weeks. But this afternoon, you will receive a copy of today's session along with the audio playback. And again, John, thank you for your time and expertise, and we appreciate it.
Thank you, Trish.